major hospitals and health systems, including several at the academic medical centers that you would be, certainly everyone would be familiar with. And what's interesting over the last 8-10 years, and I hope we'll have a chance, obviously, to talk about it during the show, is you've been working with healthcare thought leaders throughout the nation to specifically bring innovative ideas, innovative solutions from other industries, other sectors into healthcare. So welcome, Vip. It's a real pleasure to have you. You're coming in from New York, and so first of all, thank you. Tell us a little bit more about your background. I know I just gave a very brief outline.
Thank you, Ogan. Really appreciate inviting me over here to the show. My background, as you said, I'm a principal with the Crossroads Solutions Group. Crossroads Solutions Group is a management consulting, corporate rescue, turnaround company. Professionals, we are focused around, bringing some very innovative ideas into industry that we work in. We partner with private equity and investment bankers, and bring very innovative thought leadership in working with those companies.
So it's interesting. There's a lot of private equity, and we know we have the credit market turmoil and so forth. But certainly in healthcare, there's been a tremendous increase in private equity and investment banking involvement. Maybe we can touch upon that later in the show.
Sure, absolutely. Absolutely. My passion had been to bring a lot of very innovative solutions into healthcare industry from other industries, and that apply into various industry areas of the industry in the hospital sector, from nursing, from asset management, from supply chain, and these solutions have really taken the value that can be provided in healthcare to at least tenfold more than what it used to be in the past, and we can discuss those solutions.
Well, can you give an example from an external industry that's
sure, absolutely.
applied to healthcare?
Take a look at airline industry. In airline industry, there are a lot of solutions which are used to which are very similar to what can be applied to healthcare industry. If you look at the characteristics of both the industries, airlines and healthcare, from an operational standpoint, it's very similar.
Yes.
If you look at expected passenger load in the airline industry, in healthcare we have expected patient load. We have crew availability and skills mix that we need in the airline industry to fly the planes and run the operations. Same thing in hospitals. We have requirements for nurses and different physicians, clinicians, which vary by depending on what the census or the patient load is. If you look at fluctuations or weather conditions in the healthcare, in the airline industry, similar thing applies in the